It's an unbelievably complex subject. Nobody knew that healthcare could be so complicated.
President Donald Trump and the Republican-controlled Congress rolled in on day one with an imperative to repeal and replace the Affordable Care Act, or as the rest of us call it, Obamacare. 45 days into the new administration, House Republicans took their first stab at a new health care plan. They're calling it the American Health Care Act.
This is the American Health Care Act,
or the world's greatest health care plan of 2017. While House Speaker Paul Ryan certainly expected the bill would cause a rift with Democrats, he's experiencing one with Republicans as well. Here's the situation. The Affordable Care Act was signed into law in 2010 and took full effect in late 2013. Under Obamacare, 20 million gained coverage, with the largest addition coming through the expansion of Medicaid. The uninsured rate fell by about half, and the number of people signing up to the exchanges keeps growing. It wasn't until Trump took office and Republicans moved to repeal it that Obamacare became more popular than not in America. But to many conservatives, Ryan's AHCA is looking less like repeal and replace and more like repeal and revise. As expected, the bill keeps the popular under 26 provision and pre-existing conditions policy. Certain Republicans, though, are livid that it continues giving tax credits to make insurance more affordable, although they would be based on age instead of income, and that AHCA leaves the Medicaid expansion in place through 2020. Democrats object to any Medicaid rollback and say that the change on tax credits would put coverage out of reach for poorer people.
Millions of Americans don't like what they see.
The granddaddy measure of them all, though, is the repeal of Obamacare's least popular provision, the individual mandate.
We're doing away with this Obamacare penalty. I mean, it's just this tax has been such a burden on many Americans.
Here's the argument. A main pillar of Obamacare, the individual mandate, requires every individual, sick and healthy alike, to have qualifying health coverage or face a tax penalty. The AHCA would do away with the individual mandate and replace it with continuous coverage rules. People can choose not to buy insurance, instead paying higher premiums if they need it later.
we are in the midst of a rescue mission to save the families who are getting caught up in the death spiral that has become Obamacare.
By eliminating the individual mandate, however, this could truly produce the very death spiral in healthcare that many Republicans fear. An insurance death spiral is when the healthiest people are permitted to drop out, they leave behind a slightly sicker population that's more expensive to care for. Insurers raise premiums, which forces out the next tier of healthy people, making the remaining insured population even sicker, and so on. The nonpartisan Congressional Budget Office doesn't predict a death spiral, but still estimates that 24 million Americans would lose health insurance within a decade, but would trim $337 billion from the deficit during that time. Many obstacles remain to the passage of AHCA. Trump has urged wayward conservatives and moderates in his party to get in line for what is sure to be a bitter fight for approval.
It's a complicated process, but actually it's very simple. It's called good health care.